Ever puzzled over the difference between Medicare and Medicaid? Health insurance can be a tricky subject, with its own language and nuances. It's a crucial part of our lives, not just because it's often a requirement, but because it provides us with a safety net, giving us access to necessary medical services without the burden of exorbitant costs. Among the various types of health insurance coverage available, Medicare and Medicaid are two of the most common programs. Despite their ubiquity, they are often misunderstood, with many of us unclear about what each program offers, who's eligible, or even how they differ. It's important to demystify these programs to ensure we can make informed decisions about our health coverage. So buckle up as we delve into the world of health insurance, starting with a closer look at Medicare and Medicaid. By the end of this video, you should have a clear understanding of these two programs. Scene script. First up, let's tackle Medicare. Medicare is a federal health insurance program that primarily serves folks age 65 and over, as well as certain younger individuals with disabilities. It's been around since 1965, providing a safety net for millions of Americans who might otherwise struggle with healthcare costs. Now you might be wondering, who's footing the bill? Well, Medicare is funded through two trust funds held by the U.S. Treasury. These funds are filled up by payroll taxes, income taxes paid on Social Security benefits, and premiums from people who aren't automatically eligible for premium-free Medicare. So what does Medicare cover? It's divided into 4 parts, each covering different aspects of healthcare. Part A, often called hospital insurance, covers inpatient hospital stays, care in a skilled nursing facility, hospice care, and some home health care. This is usually premium-free if you or your spouse paid Medicare taxes for a certain amount of time while working. Then there's Part B, or medical insurance. This helps cover certain doctor's services, outpatient care, medical supplies, and preventive services. There's a monthly premium for Part B. Part C, also known as Medicare Advantage, is an alternative to the traditional way of getting your Medicare benefits. It's offered by private companies approved by Medicare, and includes all benefits and services covered under Parts A and B. Most plans also offer prescription drug coverage, and may include extra benefits like vision, hearing, dental, and more. And finally Part D, which adds prescription drug coverage. These plans are offered by insurance companies and other private companies approved by Medicare. There's usually a monthly premium for Part D. So, to sum it up, Medicare is a lifeline for many seniors and people with disabilities, offering coverage for a wide range of healthcare services from hospital stays to prescription drugs. So that's a quick overview of Medicare, but what about Medicaid? Now let's shift our focus to Medicaid. Medicaid, like Medicare, is also a government-run program, but it serves a different purpose, and caters to a different group of people. It's designed primarily to provide health coverage for low-income individuals and families who might not have the means to afford the costs of healthcare. It's a joint federal and state program, meaning both the federal government and individual state governments contribute to its funding. Each state has some latitude in determining the specific parameters of their Medicaid program within federal guidelines, which means that eligibility requirements and the scope of coverage can vary from state to state. However, Medicaid is generally available to people with limited income, certain disabled individuals, pregnant women, and some low-income adults. One of the key aspects of Medicaid is its comprehensive coverage. Medicaid is known for covering a vast array of healthcare services. It covers hospital visits, doctor appointments, prenatal care, child health checkups, and even vision and dental care in some states. But what sets Medicaid apart from many other health insurance programs is its coverage of long-term care. Long-term care can be incredibly costly, and many private insurance plans do not cover it. Medicaid, on the other hand, provides coverage for many long-term care services. These may include nursing home care, home health care, and personal care services. It's also worth noting that while some recipients may have to pay a small part of the cost for some services, many Medicaid services are provided free of charge. This is a crucial benefit for those who might otherwise be unable to afford these services. In a nutshell, Medicaid is a lifeline for many people, providing essential health coverage to those who need it most. It ensures that everyone, no matter their income level, has access to the healthcare services they need to live healthy, productive lives. Now that we've covered both Medicare and Medicaid, let's dive into some of their key differences. While both programs provide health coverage, they do it in very different ways. Let's kick off with eligibility. Medicare is a federal program primarily for individuals who are 65 or older, or those with certain disabilities or end-stage renal disease, regardless of their income. On the other hand, Medicaid is a state and federal program that provides health coverage to people with a low income, including some low-income adults, children, pregnant women, elderly adults, and people with disabilities. Now let's talk about coverage. Medicare coverage is standardized and divided into 4 parts. Part A covers hospital care, Part B covers outpatient care, Part C, also known as Medicare Advantage, provides a way to receive Parts A and B through private insurance, and Part D covers prescription drugs. Each part has its own set of premiums, deductibles, and copays. Medicaid coverage, however, can vary widely from state to state. While Medicaid must cover certain services such as inpatient and outpatient hospital services, physician services, laboratory and X-ray services, and home health services, states have the flexibility to determine what other services they will cover. Next, let's discuss costs. For Medicare, most people don't pay a premium for Part A, but Parts B, C, and D require premiums. Plus, there are deductibles and copays. Medicaid costs, however, are generally lower, with some states even offering completely free coverage. Recipients might have to pay a small copay for some services, but it's typically quite affordable. So, to put it simply, Medicare is a federal program for the elderly and certain disabled individuals, with standardized coverage and varying costs. Medicaid is a state and federal program for low-income individuals, with variable coverage and usually lower costs. So as you can see, Medicare and Medicaid cater to different groups of people and provide varying levels of coverage. And that's Scene 4 wrapped up. Stay tuned as we delve into how to choose the right program for you in Scene 5. Understanding these differences is crucial in determining which program is right for you. Let's dive into how you can determine which program you might qualify for, based on factors like your age, income, and health needs. When it comes to age, Medicare primarily serves those who are 65 and older, while Medicaid doesn't have an age requirement, making it more accessible to a wider range of individuals. Income is another key factor. Medicaid is designed to help low-income individuals and families who may not have the means to pay for healthcare. If you're struggling to afford healthcare, Medicaid might be the right choice for you. On the other hand, Medicare is not income-based. It's available to all U.S. citizens and permanent residents who are 65 and older, or who have certain disabilities. Health needs also play a role. Both Medicare and Medicaid cover a broad range of healthcare services, but the specifics of what's covered can vary. If you have specific health needs, it's crucial to review what each program covers to ensure your needs will be met. Now you're probably wondering, how do I apply? For Medicare, you can apply online at the Social Security Administration's website, or you can visit your local Social Security office. If you're already receiving Social Security benefits, you'll be automatically enrolled when you turn 65. For Medicaid, the application process varies by state. Generally, you can apply online through your state's Medicaid website, or you can contact your state's Medicaid office for assistance. Bear in mind that you can apply for Medicaid at any time of the year, not just during a specific enrollment period. And there you have it. The decision between Medicare and Medicaid is not a one-size-fits-all answer. It depends on your personal situation and needs. Remember, understanding your options is the first step to getting the coverage you need. So do your research, ask questions, and make an informed decision.